My name is Dr. Maryam Ba-Break from the Nafel Center for International Health and Development, University of Leeds. And I'm going to talk to you about non-communicable diseases in this short presentation. We'll try to correct some of the misconceptions about non-communicable diseases. Before we start, it's important to know what we mean by non-communicable diseases or NCDs. Actually, this term includes hypertension, type 2 diabetes, coronary heart diseases, coronary obstructive pulmonary diseases, stroke, mental disorders, road traffic accident and violence, also alcohol and substance misuse. So it does include quite varieties of diseases. The common things between these diseases, they cannot be transmitted from one person to another. So they are not communicable diseases. Now, what I'm going to do is, I'm going to list 5 statements, and during this presentation, we will try to see if these statements are true or false. So the first statement says, non-communicable diseases are diseases of rich people. The second statement, these conditions mainly occur in Western countries. Now, the third statement says non-communicable diseases affect older people beyond their productive years. The fourth statement, low and middle income countries should address the communicable diseases first before thinking about the NCDs. And the last statement says non-communicable diseases are a result of unhealthy lifestyle. So let's see if these are myths or facts. The first graph I'm going to show you is it's about mortality of diseases by income groups in all ages, according to the World Bank report in 2008. And you will see in the left side of this graph, in 2008, 14,000 million deaths happened in low-income countries because of communicable diseases, malnutrition, and maternal conditions. At the same time, we had 12,000 million cases of death because of chronic diseases. So what's described in this side of the graph is what we call a double burden of diseases. And this is a terminology used to describe those populations who are facing the rise of non-communicable diseases, generally among the affluent section of the population. At the same time, communicable diseases and undernutrition still persist among the poorest section of the societies. What we see in this graph, we had in 2000 about 30 million cases of diabetes diagnosed among those who are between 20 and 44 years old. And this number is expected to be doubled in 2030. And among those who are between 45 and 64, we had about 60 million diabetic cases in 2000, and this is expected to be tripled in 2030. So in 2030, we are expecting 150 million diabetic cases before the age of 64. And the same is expected among those who are older than 64. So in conclusion, diabetes is increasing, and many cases are detected before the age of 64. So it's not a disease of older people. Now we need to know why NCDs is increasing in developing countries. What are the causes and determinant of NCDs? Of course, there are modifiable and non-modifiable risk factors. And in this presentation, I will talk only about the modifiable risk factors, the factors that we could control, we could prevent. The first one, tobacco use, kills about 5 million people all over the world each year. Physical inactivity takes the life of 2 million people annually. About 3 million people die each year because of low consumption of fruits and vegetables. Obesity results in about 2.5 million deaths per year. High blood pressure takes the life of 7 million people annually in different places in the world. And high cholesterol level is also responsible for the death of 4 million people each year. And all these factors can be modified, can be prevented. So to put these risk factors with the common and prevalent NCDs in one graph, this is what we see in this diagram. It shows the most prevalent NCDs: cancer, diabetes, heart diseases and stroke, and coronary lung diseases. And all these three diseases are caused by 4 main risk factors: physical inactivity, unhealthy diet, alcohol, and smoking. If we put these diseases with the causes in a different framework, which is proposed by the WHO, which is in this slide, you see in the middle of this framework, you see the most prevalent NCDs: diabetes, coronary heart diseases, cardiovascular diseases, cancer, chronic respiratory diseases. And if you look at these 4 diseases, they are linked together. So for example, diabetes could cause cardiovascular diseases, and also some of the coronary respiratory diseases could cause cancers. So they are not isolated from each other, they are linked together. At the same time, these 4 NCDs, they are caused by common risk factors, again, harmful use of alcohol, tobacco use, physical inactivity, and unhealthy diets. But this diagram doesn't show one of the most important determinants of NCDs, which explain why we have more NCDs in developing countries, in low middle income countries, which is poverty. So poverty is a determinant of NCDs. How this could be explained? The first fact is NCDs affect more the poor people, the poor section of the population, more than the rich people. And poor people, they are also more likely to die because of NCDs, and we are going to explain in a moment how this could happen. On the other hand, we have tobacco use mainly concentrated among poor people, especially in many developing countries. And we just said tobacco is one of the most important risk factors for NCDs. In general, the risk of obesity is quickly shifted from the rich section of the population to the poor section of population, but that's different from one country to another. It depends. In some countries, no, the poor are affected more. In other countries, no. Rich people, they are affected more, especially in urban settings. Now, if we would like to explain how poverty is linked to the chronic diseases, we see in this diagram how this relationship is explained. Let's start from the top of this diagram. Material deprivations, poverty actually put people in limited choices, especially about how they eat and how much they eat. They eat food which is accessible, affordable. It's not necessarily they know if this is healthy or unhealthy food. At the same time, if poor people, they are pushed to work for long period, and definitely that's affect their lifestyle. Maybe they have very limited time to do physical activity or move. At the same time, poor people, they have high risk of stress, and stress affect the lifestyle. So depressed people, they are unlikely to do physical activity. So in general, poor people, they have high risk or high level of risky behavior, and therefore they have high incidence of NCDs. At the same time, poverty is associated with lack of awareness in many places. So it's not necessarily they are aware about the importance of screening themselves to see if they have NCDs or not. So awareness is a problem, but also we need to question whether the screening test for NCDs is available in developing countries, whether it's affordable for this poor section of the population. So maybe they have the disease, definitely because they have the risky behavior, but they don't know what's going on in their bodies. And they don't discover that before the complications happened. And even though if they have been detected to have one of the NCDs, we need to question whether they are affordable. I mean, the cost of the treatment is affordable or not. Because when we talk about NCDs, we talk about treatment for long period of life. It's not short course of treatment. And that's cost them a lot. And also awareness about, well, if they don't treat themselves properly, complications might happen. So they are more likely to get complications. And even when the complications happened, the cost of the treatment of the complication is even more expensive, or maybe unavailable for some diseases like cancer. So they can't afford the treatment, the cost of the treatment, and they are at high risk of death. So in conclusion, poor people, they have high risk of risky behavior, they have high risk of getting NCDs, and they have high risk of improper treatment of NCDs, and therefore they have high risk of death, because early death and premature death because of NCDs. Right, now NCDs also affect the economy of the countries. So, for example, in developing countries, adult in working age, they have higher prevalence and incidence of chronic diseases. So they have high risk of getting the complications, more absence from work, or less performance in their work. Tobacco in itself kills about quarter of its user before, well, in their productive years. For example, in South Africa, 40% of cardiovascular death happened before the age of 65. On the other hand, in 2005, China lost about $18 billion just because of cardiovascular diseases and diabetes. So in conclusion, it's not only about whether you address NCDs or not, it's about how you are going to lose a lot of money because of NCDs. So finally, what we could do to deal with NCDs, the WHO is proposing 5 main strategies, cost-effective strategies, not expensive. It's called A, B, C, D, E. A for avoid alcohol, B for be physically active, C, cut down salt and sugar in the diet, D, don't use tobacco production, and E for eat plenty of fruits and vegetables. These are very effective, not expensive, and the developing countries or the low and middle income countries need to start with these to control NCDs. Now let's go back to our statements and see if they are myths or facts. The first statement was non-communicable diseases are diseases of rich people. We have seen no, this is not true. Actually, NCDs affect poor people more than the rich people. The second statement, NCDs mainly occur in Western countries. We have seen no, this is not true. Low and middle income countries, they carry double burden of diseases. Non-communicable diseases in addition to the communicable diseases. The third statement was non-communicable diseases affect older people beyond their productive years. And we have seen no, this is not true anymore. Many cases of diabetes, for example, diagnosed in early ages, and the complications also cause premature death earlier in the life. The fourth statement was low and middle income countries should address communicable diseases first before they think about NCDs. We have seen no, this is not true. Low and middle income countries, they carry high burden of NCDs, and also it costs them a lot in terms of how many people we lose each year because of NCDs, and also how much money the country is losing because of NCDs. And the last statement was non-communicable diseases are a result of an unhealthy lifestyle. We have seen that the most risk factors are 4 risk factors: unhealthy diet, harmful consumption of alcohol, physical inactivity, and tobacco use. And all these factors about lifestyle. So I wish through this presentation we try to correct some of the misconceptions about NCDs. Thank you very much for listening.